Hello, this is Holly Wow. I did an integrative review on colorectal cancer screening. Colorectal cancer is the third most commonly diagnosed cancer and the third leading cancer death in both men and women in the United States. The American Cancer Society estimates that 136,000 individuals will be diagnosed and 50,310 will die from this disease in 2014. Although the incidence and mortality rates are that high, colorectal cancer is a disease that can be prevented and effectively treated if diagnosed in an early stage. The problem is that only 40% are diagnosed in the early stage, where the 5-year survival rate is 90%. The rate of screening in the United States ranges from 57% to 76%, with the goal of the American Cancer Society to be all states at 75% by the year 2015. This is a significant problem, and nurse practitioners are in a role that make them responsible to provide education and encourage patients to complete screening. Screening for colorectal cancer needs to be a priority because of the potential to decrease deaths related to the disease. The purpose of this review of the literature was to look at studies related to interventions that were effective in increasing colorectal cancer screening rates and predictors and barriers to patients getting screened or receiving physician recommendations. I evaluated 4 randomized controlled trials that were looking at different interventions to increase adherence to colorectal cancer screening. The settings varied between hospitals, clinics, and primary care offices. Manon and al. Looked at the effect of 2 telephone-based interventions, a tailored counseling group or a motivational interview, compared to a control group. The results were that the tailored education group and motivational interview were significantly higher than the control group. Participants reported that having colorectal cancer screening recommended by a physician was 65.4%. Sequest and al. Looked at the effect of patient mailings and physician electronic reminders on the completion rate of colorectal cancer screening. The screening rates were higher for those that received a mailing. Results were similar for those that received the physician electronic reminders, but did notice an increase when the patients had more primary care visits. The authors found that mailing patient reminders were more effective than electronic physician reminders, which is encouraging because informed physicians can play an active role in completing screening tests. Gimeno, Garcia, and al. Studied the effectiveness of an educational video-based intervention on the behavior process associated with colorectal cancer screening by the return rate of a fecal occult blood test. The return of the fecal occult blood test kits were significantly higher among the intervention group. Vernon and al. Assessed the effect of a tailored interactive computer-delivered intervention, a viewing of a public website about colorectal cancer screening, or a control group, and found that there was no difference in the outcome of the screening rates based on these interventions. Ramdas and al. Conducted a cross-sectional survey study to look at factors that were associated with noncompliance with colorectal cancer screening. The results showed that patients that did not have a colonoscopy, 38.5% reported that they just didn't want to have one, and 30.8% reported that their physician did not recommend it. Of the patients that did have a colonoscopy, 82.7% received provider recommendation for their screening colonoscopy. Of the patients that had never had a colonoscopy, 78.1% reported that if their doctor strongly recommended it, they would have the procedure. Several of the studies showed the importance of physician recommendation to patient adherence to colorectal cancer screening. All the studies recognized the importance of further research building on their results to identify ways to effectively increase colorectal cancer screening. The studies in this literature review were valuable to nursing practice in identifying ways to increase those colorectal cancer screening rates. Priority needs to be focused on patient adherence to screening because it is a preventable and very treatable disease if diagnosed in an early stage. The findings from this literature review could be applied to improve colorectal cancer screening by utilizing the knowledge and role of the nurse practitioner. Research suggests that patients tend to be more likely to get appropriate screening if recommended by their primary care provider. Nurse practitioners in primary care practices have the knowledge and experience to provide information through effective communication with their patients. In conducting this literature review, not much research has been completed on the effect of one-on-one education with patients in a primary care setting. Nurse practitioners build a trusting relationship with their patients, making them more willing to obtain screening that is recommended by them. An intervention that could be proposed is in patients that are aged 50 to 75 that have not completed colorectal cancer screening. How does one-on-one education by the primary care provider increase colorectal cancer screening adherence? This would be appropriate in a primary care setting. Priority needs to be placed on future research until every state has reached the goal of 75% screening rate for eligible patients. Thank you.